Hello, my name is Justice Norman, and today I'll be going over my case study for athletes with an amputated limb. Okay, to start, uh, amputation is a surgical removal of all or part of a limb or an extremity, like an arm, leg, hand, finger, etc. Roughly 1.8 million Americans are living with an amputation today, and the most common amputations are either above or below the knee. In reasons for amputations, the most common is poor circulation because of damage of narrowing of the arteries. That's also called peripheral arterial disease. Other causes include severe injury, usually a vehicular accident, or in rare cases, like a cancerous tumor could be the cause of an amputation. More causes, like the ones we'll look at later, in the case of Hunter Woodhall, he uh, he had fibular hemimelia, which is a birth defect where part or all of your fibular bone is missing. In another case we'll look at later, in Anthony Robles' case, he was born with one leg for an unknown reason. Reasons why patients or doctors would avoid an amputation. It could be because the patient is allergic to the anesthesia that they'll be using, or just the patient is in really poor health. However, an amputation is usually like a last-ditch effort to save somebody's life. So it's really rare if they weren't to do the amputation because of one of these reasons. Okay, amputations in America. The number one cause of a limb loss is vascular disease. That's about 54% of the cases. That includes diabetes, peripheral arterial disease, like I said earlier. The second leading cause of limb loss is trauma, like I said, the vehicular accidents. That's about 45%. And the third is cancer, which is less than 2%. So pretty rare. And like I said earlier, nearly 2 million people are living in America with a lost limb. That's approximately 185,000 amputations occurring each year. Okay, so now we're going to get started with the athletes with amputations, and we're going to talk about their barriers. So, athletes with amputations are a population in sports that has many barriers, and it also has many controversies in today's society. In the past, an athlete with an amputation would not have been considered a threat to an able-bodied competitor, and especially in the sports world. Um, and there are many barriers as one can imagine for an amputee. As technology evolved, though, many of these barriers have been diminished. Okay, so some of where the controversy comes in with these athletes with the amputations. So present day, there are some athletes who break through these barriers and break through their conditions and are able to compete with the best athletes in the world. Some of these athletes, such as Anthony Robles, who I mentioned earlier, he was an NCAA champion wrestler. He was the one who was born with one leg for unknown reasons. And then we have someone like Oscar Pistorius, aka the Blade Runner, who was a Paralympic champion and the first double leg amputee to participate in the Olympics. We'll talk about him a little later. And we have Hunter Woodhall, who was the Utah State record holder in the 400-meter track and field event, and also made the 2017-2018 Arkansas track team. Okay, so the controversy over whether these athletes that were said to have too many barriers to participate in able-bodied competitions, that now their prosthetics are giving them an advantage over able-bodied athletes. So when we look at the controversy over the prosthetics, we look towards Oscar Pistorius' story. So both of Pistorius' legs were amputated below the knee when he was about 11 months old. After becoming the Paralympic champion, Oscar attempted to enter the non-disabled competition league. So that's like the Olympics and not the Paralympics. He was very persistent and he had to fight many battles just so he was legal to participate in these in the able-bodied sports competitions. But after, like I said, after many hard battles, he won the legal dispute, and he became the first double leg amputee to participate in the Olympics. He changed the way athletes with disabilities were looked at in the world of sports. But however, it was argued that Oscar's J-shaped prosthetics are not like the lower limbs of an able-bodied athlete. So they're saying that this gives him an advantage. They're saying that research showed that it could store more energy and act as a spring and not as a able body, like as a leg. However, much more research is needed to determine this. And then we can go over to the controversy with an amputation, so with no prosthetic. So we'll look at Anthony Robles' case. He's the person who I described earlier, who was born with only one leg for an unknown reason. He's a wrestler who won the 2010-2011 NCAA Individual Wrestling Championship in the 125-pound weight class, despite being born with only one leg. Without his one leg, he is able to have much more muscle mass around his arms and his core, as can be seen in the picture below, or to the right, thus being stronger than all his opponents at the 125-pound weight class. So it was said that since he had only one leg, that could take about 45 pounds off your muscle or off your body weight. So he was able to put that body weight somewhere else. Now, many people find that controversial, and this is a clear advantage for Robles. However, is it an unfair advantage? Because he's not using a prosthetic or any extra equipment. He was born without his legs due to an unknown birth defect. So he's just out here competing with the body he was born with. So that's why there hasn't been many disputes about whether his titles should be taken away or if it was unfair, even though he had this advantage. Okay, so now we'll move towards our case study. And the case study is kind of modeled after the track star who was born without his lower legs, and he became the Utah State champion. So his name is James, and he is a 15-year-old male who was born without his lower legs by an unknown birth defect, much like Anthony Robles. With his prosthetics, he is about 6 foot and weighs 150 pounds. Mike has no heart defects and no family history of heart problems. His blood pressure is 116/80. His blood glucose levels are 92, and his HDL levels are 50. And his LDL levels are 126. James is on the track and field team, so he is very fit. His track regimen has a high volume of aerobic and anaerobic exercise, as well as powerlifting and resistance training. He has never been a smoker. Okay, so for the risk stratification, his family history, he is at no risk. And then we go towards obesity. And I say that he's at no risk, but I say it's hard to get an accurate BMI because James is a double amputee. So he technically will be considered underweight for being 6 foot. And then we check his activity level, and he is at no risk because he's a very active member on the track and field team. Blood pressure, he isn't at a risk because he is under 120 and he is not above 80. And for his cholesterol levels, he is also at no risk because he is under 130. His fasting glucose levels, he's at no risk because he is not 100. And because he's not over 100, and he is no risk for being a smoker because he does not smoke. And so after going over all those factors, he's at a low risk because he is asymptomatic and has 0 risk factors. Okay, so now we get started on the exercise assessments. His goals are to improve his balance and increase his lean muscle mass, and also to increase muscular strength and power. Okay, so the testing that we'll put him through would be the muscular strength test. It could be a 1RM bench press, a muscular endurance test, such as a sit-up test and a modified push-up test. It will be modified because he is a double amputee. And we would put him through a cardiovascular endurance test, which could be a 1 mile test. and also a balance test, which could be the Stork test with your eyes open and closed. Just real quickly, we can go over the warm up. It will be a 10-minute jog, static stretching of the major muscle groups, and dynamic flexibility stretching. And for the cool down, again, something light, the static stretching of the major muscle groups, allowing the heart rate to come down. So we'll start with the powerlifting and the resistance training. This will be, the frequency will be 3 days per week. The intensity will be 80%, one repetition max until the progression of the cycle continues. So it'll be 80, then probably 85, then 90. And then the time will probably take about 60 minutes to complete the lifting. And so the types of lifting will perform powerlifting, which can include medicine ball throws, cleans, jerks, everything from that nature. Then strength training will be followed by that. It will be upper and lower body. And we'll also make sure that we hit the anterior and posterior chains with push and pull exercises. And then we'll incorporate core exercises throughout the workout. Okay, so to conclude, days where having an amputation limits one to just walking as close to normal again are over. Of course, there are cases when that is what's best for the client, but however, in athletes with an amputation, athletes with amputations have been proven that they can still compete with any able-bodied person in sports. The future is very bright for athletes with amputations and prosthetics. Okay, and here's my works cited. Thank you very much for listening.